Greetings. My name is Dr. Nick Kouchis, and I am a board-certified family physician and medical acupuncturist, and I'd like to speak with you today about the COVID-19 rapid de-stress protocol needling technique. As a frontline healthcare worker, you have a unique experience in working and handling needles that is going to be very valuable to this educational program of learning how to use that needling skill set to provide your patients this protocol that could help return them to a calm and centering after experiencing stress and trauma in caring for patients during this COVID-19 pandemic. Your experience includes basic phlebotomy, subcutaneous injections, intramuscular injections, and intravenous catheter placements. So you understand the fundamentals of handling needles, safety regarding needles, how to use them to penetrate the skin, how to be aware of your patient's response to being needles. I'd like to provide some relative comparison between the size of the needles we use in the protocol relative to your needles on a syringe, sewing needles, and a matchstick. Here you can see a medical syringe with a 28.5 millimeter diameter, beveled, cutting, hollow needle relative to an acupuncture needle, which can be 0.25 millimeters in diameter, comprised of a solid stainless steel material that is sterile, meant to be used only once and then properly disposed of. Here you can see how the needle comes in a package where there is a clear guide tube that we will use to insert the needle safely and effectively, along with a wadge that supports the needle within the guide tube. The proper technique is to identify the point that you wish to needle. Place the guide tube that contains the needle and chad over the area of skin that you wish to insert the needle, whether it be over the ear points or the head or body points. You will support the guide tube with your non-needling hand as shown here. Then remove the chad and allow the tip of the needle to rest upon the skin. With a swift press down with your needling hand, you will insert the needle into the skin, penetrating the epidermis and dermal layer. It is important to be brisk and firm in this tapping so that you can advance the needle beyond the dermal layer where the nerve endings that sense pain and irritation exist. I will now show you a demonstration of the full procedure of inserting the needle using the guide tube, practicing on an orange, which I recommend you can do while at home in preparation for needling a partner, a coworker. You'll see here I have the package of the guide tube needle and chad. As I remove this, I can dispose of the plastic package, and with the guide tube and needle and chad in place, I position it properly over the area of the orange that I wish to needle and secure it in place with my non-needling hand. Next, I remove the chad and dispose of that. It allows the tip of the needle to rest on the skin of the orange. Next, I briskly tap down onto the handle of the needle, inserting the tip into the orange skin. I can then remove the guide tube, allowing the needle to hold firmly on its own. Now for body points, I will advance the needle a millimeter or so, then give it a rotation clockwise and counterclockwise, followed by further advancement and further rotation until I get to the proper depth to achieve the sensation, which we will discuss here shortly. When I'm finished needling, I remove the needle swiftly and briskly, and then please properly dispose of these needles. Finally, I'd like to speak a little bit about an observation that we see when a patient is needled that we call needle shock. Once in a while, and frequently upon a first or second needling experience, a patient may start to describe or show signs and symptoms that are lightheaded, feelings of faint, nausea, paleness in the face, clamminess of the skin, loss of visual focus, and a want to lay down or to lose consciousness briefly. Most of us have experienced this in our patients, and we're aware to be observant and to have a good facial awareness of our patients so that we can prevent this or reverse it if it does occur. Use caution in positioning your patients for these needling protocols. Seated is not as advisable as lying down for the first few treatments. If your patient does experience needle shock, first off, protect your patient from rolling over or falling down onto the floor. Second, remove all the needles as quickly as possible. Elevate the patient's legs to return blood flow to the brain. Maintain verbal contact with your patient, trying to keep them aware and stimulated so they don't close their eyes and lose consciousness briefly. Finally, you can also take your fingernail and slide it underneath the cartilage of the nose along the bone and stimulate it moving side to side. This is a very powerful acupuncture point that is known to reanimate someone when they're losing consciousness or feeling faint. And it'll bring attention to their vision and focus and allow you to keep them from experiencing further needle shock. Once a patient has been relieved of a needle shocky sensation, no further treatments on that day are recommended, as the patient should be allowed to have something to drink, have something to eat, and go the rest of the day in moderation to recover fully. Thank you very much for your attention. I look forward to working with you in live guided tutorials of these techniques as your interest and passion to pursue the COVID-19 rapid de-stress protocol proceed.